Robin, what's Leapfrog about?
Leapfrog is a CEO-sponsored program of really important initiatives that we're trying to have a big impact in a relatively short space of time. So they're quite small, simple, agile projects.
So our focus is on our patients and our staff, things that'll make a really big difference in their lives. We've brought all this amazing work together in our Institute for Innovation and Improvement. We've got 4 streams of work: care redesign, health leadership, digital transformation and innovations in research, and we're making all this happen.
Most of these projects are led by clinicians, and that's been really important in bringing everyone else along on the big change in the way that they work. And this will also help us to engage better with our patients and with primary care.
eVitals is the future of charts. We're using iPad minis. No data is held actually on the iPad minis. It's held on servers securely. It's going to make patients safer, but it's going to reduce the time we as health professionals spend looking for notes, looking for charts, the observation charts, the fluid charts, the prescription charts. For the patient, it means their data is immediately available to all the people who need it. And the start of the iPad mini is e-prescribing and eVitals, so observation charts and prescription charts.
So e-prescribing and administration essentially takes the paper drug chart, which used to sit on the end of the bed, had lots of associated problems, sometimes got lost, sometimes was hard to read, and makes that entirely electronic. Doctors are able to access that on a computer on wheels on a ward round. Nurses are able to use that on an iPad and take the medication chart to the patient's bed to administer medications.
Hey Robin. Hi.
So now that we've put electronic prescribing and administration in, patients are a lot safer when their medicines are prescribed, dispensed and administered. So we've got dose range support, we've got interaction checking, we've got allergies, we've got all these sorts of things that relied on humans to make sure that things were okay before. Now a computer checks those before the nurse gets to administer the drug to the patient.
E-orders is about the clinicians being able to place an order for radiology wherever they are, in the hospital, at the bedside, looking at the patients. The real thrust of the e-order is to get the radiology report back and to push it to the clinicians. Everybody who's dealing with that patient knows the order's been placed, knows the radiology procedure's been done, knows the report is there, and knows that the person who needed to sign it off has actually signed it off, or if they haven't, that they haven't. So it really closes that entire loop where you order, you get the report, and you sign it off. And we're doing it for radiology and we're doing it for laboratory tests as well.
New line bullet point transferred to hemodialysis August 2011.
The Voice to Text project involves us dictating in a computerized system, interpreting our dictation into text.
New line bullet point.
The accuracy has steadily improved and is now over 90%. The system has been great in terms of learning. It's picked up my accent and learned my catchphrases.
The DHB has a drive to increase its digital footprint and remove paper out of the environment, because having paper and digital is a risk in itself.
Leapfrog is about innovation and it's about acceleration. Leapfrog has been achieved at relatively small cost for really large gains. It's nimble, it's fast, it really involves our staff, and they're really proud of our program of advancement.
The patients are really positive in having these iPads in the wards because it gives them access to the outside world in terms of accessing their emails, Facebook, doing internet banking, paying the bills online, and even doing shoppings online.
The iPad for me has kept me going over nights of lack of sleep. You can access the news, the crosswords, there's Facebook on there, and in the mornings we run a bit of music through YouTube, and we find music that everybody's happy with in the room, and it just gives us a mellow start to the day.
The mobility program has been about delivering capability into the hands of clinicians, enable them to manage their day and their patients through the palm of their hand without constantly having to refer back to information systems and computers that are tied to specific locations.
Our community
community clinicians complete about 155,000 visits to patients in the community every year. We set up a project to roll out mobile devices to all of our community allied health clinicians. For the first time, we're actually making our clinicians mobile and connecting our community with our hospital services.
The change for nurses is huge. We've been using paper for hundreds of years.
The change to the people using the system is the critical component.
They're committed individuals who are really driven to succeed in improving patient outcomes, raising the bar really.
Percy is our patient experience reporting system. It's essentially a new electronic survey tool that lets us hear from thousands of people every year. And if you think about our core business, which is looking after the health and well-being of our population, about 600,000 people, it's really critical that we hear from them about what's working and what isn't, so we can tailor everything we do to the needs of our population.
Leapfrog is one of the most exciting organisational transformation programs that I've been involved in the last 3 decades. What's breathtakingly different about Leapfrog is that it represents a culture of innovation. It's not simply a project in itself, and it has been successful because the whole program is actually driven by people on the shop floor. The people that will use it are the people that are driving it.